All right, everyone, we are going to go ahead and get started. It seems like folks have come in from the waiting room, and we'll go ahead and kick off today's call. Hi again, my name is Harper Schwartz, and I am the Director of Special Projects here at Mental Health America. We are so excited to be here with you today for our informational call for our Community Impact Zone grant opportunity. We opened up the opportunity about a week or so ago, and we just wanted to take time today to give you an overview of the grant and the process. So here is our agenda for today. We will do a brief overview of MHA, Mental Health America, who we are, and then a quick overview of the Community Impact Zone project. We'll then dive into the details of the application process. We will also hear from my colleague, Maddie, who will do a deep dive into the New Jersey Community Assessment findings that you all use in your applications. And then finally, we will have time for some Q&A. So first, a little bit about Mental Health America. You may already know about us, but just quickly, this opportunity is coming from our national office, and we have over 143 affiliates across the country. Our work is really anchored in public education, research, advocacy, public policy, and direct service. We focus on prevention and early intervention and are committed to anchoring all of our work in lived experience. And really a through line of all of this work is a focus on access to mental health resources and support. Now I just want to talk a little bit about the why behind the Community Impact Zone project. This is an opportunity made possible with support from Otsuka America Pharmaceutical. And what the Community Impact Zone project seeks to do, and what we're really trying to address, is rooted in something I think we all can understand. It's that communities know best what they need and how to solve the unique challenges they face. But these solutions that could help close mental health access gaps are often blocked by longstanding systemic barriers. And these community-led solutions are really exactly what's needed to address local problems and opportunities, but they're often unfunded or underfunded. So what's really truly needed here is a catalytic investment, excuse me. So our solution to all of this is to provide funding and technical assistance to uplift and support community-driven solutions. We're offering a multi-year investment, which we will hope will help break down systemic barriers. We're also hoping this will serve as an evidence base for local solutions to mental health access and will lead to regional investment for sustainable scaling. So a little bit about our approach that we are taking. We are launching a streamlined RFP process, and I will get into the details of that in just a moment. But we're doing an RFP process and we'll select a local organization or organizations to support a community-based and community-led strategy and really partner together with MHA to drive and to support a specific mental health access issue that you're seeking to address. We're calling these areas community impact zones. For our first cohort, we focused on organizations serving Burlington County and the city of Trenton. And we are now launching our second cohort in new communities. So for this new opportunity, our second cohort, if you will, we are looking for applicants who are in the following New Jersey counties: Atlantic, Camden, Essex, Gloucester, and Warren. An applicant should be either currently working there or aim to work and support individuals there to address a mental health access gap with either a new or already existing project, program, or initiative. And the goal of all of this is to improve the well-being of communities. The funding will be for 2 years and range up to $345,000 per year. So now a little bit more about the process. We have really tried to make it as easy as possible, and there are primarily three somewhat simple steps. The first is our eligibility assessment, which opened on May 12th, and you can go in and take the eligibility assessment through June 13th. The eligibility assessment is used to determine if you will be able to move forward to step 2, which also is open from May 12th to June 13th. And then an invitation to submit full written proposals will go out on July 1st. And then we have the third and final step, which is a submission of a full written proposal from July 1st to July 31st. So like I mentioned, the eligibility assessment is the first step that helps you move forward in determining if your organization is eligible for this opportunity. There are very important requirements for this opportunity. So when you go into the eligibility assessment, you will be asked to complete a series of questions. If you qualify, you will then be prompted to submit a concept proposal. And I just wanted to highlight two quick things here. When you log into the grant platform, there will be language that refers to an application, but please know that the eligibility assessment is just referred to as an application in the system. So if you see any language like that, don't be confused. You're in the right place. This is for the eligibility assessment. And second, if you do take the eligibility assessment and you find out you are ineligible and have questions, please feel free to reach out to MHA. I will share my email at the end of this call, and you can also reach out to me directly in that way. So once you take the eligibility assessment and it's determined that you are in fact eligible, you will be able to access the concept proposal in the grant platform. You will also receive an email with directions for next steps. The concept proposal will ask you to complete 12 short answer questions, and we have broken these down into two parts. So part one is going to ask you about 8 narrative response questions, and then there are 4 questions that are in the yes/no format. Again, concept proposals are accepted from May 12th to June 13th, and we will review them by July 1st. And all applicants will receive an email about their status, regardless of if they're selected to move forward. So if you submit an application, a concept proposal, you will get notified yes or no, regardless of your status to continue. All right, now we're going to dive into the concept proposal submission and the different format options. Because we want to make the process as easy as possible, we have provided different options for you to submit your responses in so that you're submitting in a format that feels most comfortable to you. We did not want the application itself to be a barrier to applying, so we are offering 3 different response options. For a narrative response, you can use a written format, whether that be a Word document, a Google Doc, really anything where you can type your responses in one document to upload. You can also choose a video response. You would essentially go ahead, create one video that addresses all of the narrative questions. It should be about 30 to 90 seconds for each narrative question. And the idea here, again, is if writing isn't your strong suit, we don't want that to be a barrier. So instead, you can just go ahead, hop on a video, and talk us through your concept proposal. And finally, the third option is a presentation. You can use anything, PowerPoint, slideshow, Google Slides, Canva. You just go ahead and create a presentation in your chosen format and create 1 to 2 slides per narrative question, and then you just upload that file to the grant management platform. For all formats, you will need to respond to questions 9 to 12 directly in the grant management platform. So again, really want you here to select whichever format works best for you to tell us about your concept proposal and your idea for this project. An important piece of the concept proposal, the application, is the New Jersey Community Assessment findings that we have provided. And like I mentioned, Maddie is going to talk us in a little bit about the data, but just high level, we use data from Mental Health America's National Screening and Prevention Program, along with government health sources, to conduct a community assessment. And we did identify 5 high-risk counties in New Jersey, those being, again, Atlantic, Camden, Essex, Gloucester, and Warren. These counties, they had the highest rates of residents screening at risk for mental health conditions, along with community level challenges that contribute to elevated mental health risk compared to other counties in the state. And what we did is we went ahead and provided these key findings to you all, and then asked that you use this information in creating your concept proposal. So really what we want you to do is to look at the data, see what it's telling you about your community, and then your concept proposal should go ahead and address how your solution may be able to address what we're seeing in the data. And again, we will hear more about this in just a moment from Maddie. All right, so finally, if your concept proposal moves forward, you will be invited to step 3, which again is a full written proposal. A few organizations that meet all of their criteria and provided an innovative solution to address mental health access gaps in their community will be the ones to move forward. Before submitting the written proposal, applicants will have the opportunity to meet with Mental Health America, to meet with our team to receive help on their proposal. So we'll provide technical assistance, including support on evaluation measures. This technical assistance support before the application is submitted is really unique to this opportunity. And I love that it allows us to work together to create a project that really is both intentional and actually useful to your community. And then just again here, the written proposal period will begin on July 1st and submissions are due on July 31st, 2025. The next slide, I'm going to go ahead and play that recording from my colleague, Maddie Reiner, who's going to tell us more about the New Jersey community assessment findings that you will all use in your concept proposal applications. We'll go ahead and hear from Maddie now.
Thank you so much for joining today. I'm Maddie Reinert. I'm the Senior Director of Population Health at MHA. One of the first steps in this community impact zone process was for us to conduct a really high level community needs assessment to start to understand where there are the highest rates of mental distress in New Jersey and what factors may be contributing to that distress. All of the findings from the community needs assessment that I'll be walking through today are included in our request for proposals on our website. But we just wanted to take this time to give a brief overview of them and lend more context to those findings and how we got to them. So first, where did this data come from? Half of the data that we used for this community needs assessment was collected through MHA's online mental health screening program, which is a collection of these 11 free, anonymous, confidential, and clinically validated screening tools that we've put online for people to use on their own time. So these are the same tools that would be given to screen for mental health conditions in a provider's office, but we put them on our website beginning in 2014 because we know that people are likely to turn to the internet to search for mental health information and supports online on their own, often long before they would take their concerns into a provider's office. So when someone seeks help for their mental health on the internet, often through a search engine like Google, and finds our website, they're able to take a screen and receive immediate results and resources to support them. On our end, we're able to collect de-identified data from the screening tool itself, as well as a number of optional demographic questions. And this demographic information includes location. So we ask for zip code and state, which is how we've been able to get the data that we've used for this community needs assessment. It also includes questions around race and ethnicity, household income, and even what's contributing most to someone's mental health concerns at the time of taking a screen, which is where we've gotten a lot of the information that we'll be walking through today, and that we have online for the RFP in that data portion. Since we launched the online screening program, we have had over 30 million completed screens. So even at the state, county, and down to the zip code level, we have a large data set to pull from. And just for this community needs assessment, we were looking at screening data taken through our website from 2020 through 2024. And we started by running this data to understand where geographically we saw greatest overall mental health risk based on the data from that screening program. So overall mental health risk here we defined as receiving a positive result on any of those 11 screening tools that you saw in the previous slide. And looking at the map here, the darkest blue zip codes are those that had the highest number of people screening at risk for a mental health condition per 100,000 people in the zip code population. And that lightest blue are zip codes with the lowest number of people scoring at risk per 100,000. You'll see that there are a couple blank areas on this map of the state. That's really just because we only, for this overall mental health risk, looked at zip codes with a high enough sample size for us to really be able to dig into that nuanced demographic data and better understand populations that were scoring at risk within these zip codes. So this map is really only showing zip codes where 100 or more people took a mental health screen and received that positive result. You'll also see that there is a blank area where Burlington and Mercer counties are. That's because we did a community needs assessment of those two counties for our first round of community impact zones. And so just for the purposes of this second analysis, we excluded them because we already had that information. When we look at this map, there are zip codes in that darkest blue that are standalone. So meaning there may be a zip code that is in that darkest blue, highest risk group, but all of the other zip codes around it are not also high risk. We did not focus on those zip codes because we wanted to choose areas that we could see showing consistent risk or where we knew one project could impact a really large zone of folks that were scoring at highest risk for mental health conditions. And we started to look for where we could find these clusters or regions where multiple zip codes were showing very high risk from our screening program. And so one of the ways that we did that is in this table to the right. We took all of the highest risk zip codes and by county, we looked at how many of those highest risk zip codes there were in each county. And so here you can see at the top we have Gloucester, Essex, Camden, and Atlantic, all with a decent number of those darkest blue highest risk zip codes within one area. And so that's right away how we started to see those clusters of higher mental health need. This is basically this looking per 100,000. It's showing us where there is a disproportionately high number of people experiencing mental health conditions based on the population. In addition to looking at just this overall mental health risk, so again, a positive result on any of those 11 mental health screening tools, we also evaluated the number of people screening at risk for each of those 11 individual mental health conditions. So ranked the zip codes from highest risk to lowest risk for all conditions. And then we were able to identify the geographic areas that consistently came up as highest risk, both overall and by individual mental health condition. And those were Gloucester, Essex, Camden, Atlantic, and actually Warren counties. We then started to take those counties and dig into the demographic data from the folks we saw that were screening at risk there to get a better idea of what may be going on for those people and what kinds of projects or things we could address that would really have an impact on their mental health. And we did find some consistencies across all 5 of those highest risk counties. So one was that youth under age 18 screened at risk for mental health conditions at higher rates than any other age group, and those who identified as LGBTQ plus screened at risk at higher rates than non-LGBTQ plus screeners. These are both risk factors that are pretty consistent across our screening program in general. So it wasn't extremely surprising to see that consistently across these high risk areas, but those are 2 really at-risk populations that we know could be good populations of interest for a community impact zone project. We did also find that individuals who identified as Hispanic or Latino or more than one race screened at risk for mental health conditions at higher rates than those who identified as white, non-Hispanic, across all 5 of these high-risk counties. And then specifically in Atlantic, Gloucester, and Warren, we also saw that screeners who identified as Black were more likely to score at risk for mental health conditions than white screeners. So we could start to see these pockets of populations at higher risk in these areas. These are all populations, again, that could be a focus for a mental health community impact project. Our demographic questions also allow us to dig into what people are saying is affecting their mental health when they're coming on and taking a screen and looking for that support. In these higher risk areas across the board, folks were more likely to report financial problems, really having an impact on their mental health than we see on average for screeners in the state. In each of these counties, we also saw that the average household income reported by folks screening at risk was lower than that state average or median household income. And we saw that lower household incomes were more likely to be reported by screeners who identified as Black, Hispanic, or Latino and multiracial than we saw among white individuals. When we asked in our demographic questions, what are the top 3 things contributing to their mental health problems at the time, in addition to financial problems, we also saw a higher percentage of people reporting abuse or violence in Atlantic and Warren counties, higher rates of grief or loss in Atlantic, Camden, Gloucester, and Warren. And then higher reported rates of relationship problems, which we sometimes see as a proxy for things like domestic violence or family conflict in each of these highest risk counties, except for Gloucester. And then just to emphasize the level of immediate mental health risk in these areas, over 30% of our screeners on average in New Jersey report experiencing frequent thoughts of suicide or self-harm when they're taking a screen through our screening program. But that percentage was even higher in each of these counties, especially as you can see in Camden, Warren, and Atlantic, where rates of suicidal ideation were 2 to 3% higher on average than what we saw in the state. All right, so that's what we saw in our mental health screening data. Our research team also took a deep dive into outside data sets like census data, data sets from the CDC like the Behavioral Risk Factor Surveillance System, and New Jersey specific data collected by the state to get a sense of risk outside of just our mental health screening population. So I'll run through these really quickly because I know many of you are probably very familiar with a lot of this data. This is really just to show that as we started to look at these community indicators like unemployment rates, which you can see in the map on the left, and incarceration rates on the right, in both of these maps, that dark blue area is where there is a lower unemployment or incarceration rate, and those dark orange areas are where there's a higher unemployment or incarceration rate. We were starting to see the same zip codes that we saw as high risk in our mental health online screening program data in these other data sets as well for these community risk factors. Here, same thing with education data. These are showing in areas that are colored orange. Those are areas with a higher percentage of people reporting either a high school diploma on the left or less than a high school diploma on the right as their highest level of education. And so, oh, sorry about that. So again, here, seeing those same areas of risk come up over and over again in these same counties. So all of these additional analyses were showing us that that higher mental health risk we saw from our screening program was correlated with poor or lower educational outcomes, lower income levels, higher unemployment, and increased incarceration rates at the zip code level. So we saw those same clusters for many of the indicators in those same counties, in those same zip codes that we had identified as high risk from our mental health screening data. We also wanted to understand the landscape of available mental health services in these 2 counties. So here we have a screenshot from the SAMHSA treatment locator. This is just a screenshot of Atlantic County, though we looked at the availability of treatment facilities across all of the 5 high-risk counties. And when comparing zip code level mental health data to these maps, many of the zip codes that we saw with really high mental health risk had few or even no available mental health or healthcare, community healthcare facilities. So for example, in Atlantic here, zip codes in Absecon, Mays Landing, and Summers Point were all within the top 25% of high-risk zip codes across the whole state of New Jersey. And we can see from the screenshot where these yellow dots are mental health facilities listed by SAMHSA, and the green dots are community health centers listed by SAMHSA. In these areas, there are really one in Absecon, one in Mays Landing, and then none in Summers Point or nearby. So we're really starting to see a gap in access for the same areas that we're seeing come up with high mental health risk and high risk in other community factors. And just to verify this finding, we also ran correlations at the zip code level between our MHA screening data and outside data sets to really understand the neighborhood factors that we could see increasing or decreasing the chance that someone's screened at risk for a mental health condition. And kind of unsurprisingly, consistent with what we're seeing on this map, we found that higher rates of things like annual checkups, and screening for chronic conditions or screening for cholesterol were correlated with a lower chance of screening at risk for mental health conditions, indicating that higher access to healthcare or more emphasis on preventative healthcare in general were really beneficial to mental health, or may indicate that folks were able to receive resources already. Areas with higher rates of chronic health conditions like COPD, diabetes, these were correlated with a higher chance of screening at risk for a mental health condition, suggesting that that lower access to care or some of those neighborhood or socioeconomic conditions that impact physical health are also having impacts on mental health risk. So it might just be showing that in these areas, people really don't have access to that preventative or community conditions that are promoting mental health. So I know that was a lot of data. That was just a more thorough explanation of all of these findings that we've outlined. Again, they're all on our website as part of that request for proposals. And I'm happy to take any questions that you have at this time. Thank you.
All right, like Maddie just shared, we will open up our question and answer session right now. Feel free to go ahead and type any questions into Zoom, the function directly, and we'll go ahead and answer them live. The first question we have is on Maddie's data presentation. The table presented financial concerns, violence, relationship issues, etc. Were these figures for all screening or just those screening positive for suicidal ideation? Maddie, I'm going to invite you to come off mute if you're able to and answer this question.
Great,
We'll see
thank
if we
you.
can get you on.
And
Oh,
hopefully, okay. I was going to say,
perfect.
hopefully you can hear me. Apologies for any background noise because I'm currently traveling. But yes, those are two separate tables. So the top table is all of those financial concerns, relationship problems among folks who scored at risk on any screen. And then the bottom table is just looking for folks who reported that frequent suicidal ideation.
Great. Thank you so much, Maddie. Our next question that I see is, do you have to be a nonprofit to qualify? The answer is yes. For this grant opportunity, you do in fact need to be a nonprofit organization. If you log in and take the eligibility assessment, you'll be prompted to answer that question directly in the system. So yes, the answer is you do in fact need to be a nonprofit to qualify. Next question I see is, can a nonprofit organization partner with a state mental health association affiliate for this grant opportunity? Yes, that is absolutely an option. When you fill out the concept proposal, there will be a question and it'll ask you, are you partnering with anyone for this grant opportunity? And you can select yes and kind of answer the questions that way. And I will share that in our first cohort, we did in fact have a similar partnership with our affiliate in New Jersey, partnered with a local organization, and they went ahead and submitted a project for this opportunity. So yes, the answer is yes. All right, next question I see. Can you share the highest risk zip codes for Warren? There are two. Maddie, I don't know if you're able to come back on and talk to us a little bit about highest risk zip codes for Warren.
Yeah, we might have to give that to you in a follow-up if you want to reach out via email. I believe they were all in the Phillipsburg zip code.
Great, thank you, Maddie. So it sounds like the best way for us to get you that info, if you want to go ahead and send an email, I'll show you before the end of the presentation a slide with my contact info. Feel free to email us and we will be happy to get that info for you. All right, next question I have. How about if we have an application submitted to become a nonprofit? Are we eligible? At the time of your application, you do need to be a nonprofit. So when you go through that eligibility assessment, it will ask you, are you currently a nonprofit? And you do need to be a nonprofit organization to continue with the opportunity. The answer is you do need to be a nonprofit at the time you are applying to this opportunity. I hope that is helpful. Howie, I think it is. If you have further questions, feel free to reach out and we can help get those addressed. The next question I have is, are state universities or institutions eligible? Again, if you're a nonprofit, you're welcome to apply. If there are specifics about your university or institution that may or may not be eligible, once again, you go through the eligibility assessment and you will kind of find out. But we do know that you need to be a nonprofit to be eligible. So keep that in mind if you are applying as a state university or institution. All right, I see a bunch of questions rolling in. This is great. The next question we have, if you were found uneligible after completing the assessment, can you complete it again? So the system will allow you to complete it again, but most likely that'll lead to a flag and you will get an email from myself kind of asking you why you selected say yes in the first time completing it and why you said no or yes in the second time completing it. So if you submit an eligibility assessment twice, it'll get flagged and I'll be reaching out to follow up to kind of make sense of what's going on. So if you have any specific questions, let me know. Otherwise, it'll get flagged and I'll be reaching out shortly. Okay, next question. Are you most interested in mental health treatments, prevention programs, both? So we are interested in any innovative project that addresses the kind of community impact assessment that Maddie just reviewed. We're not specifically interested in a certain topic. More the kind of idea behind this is that you know best what's going on in your community, and we want to see innovative projects that are addressing mental health access gaps that you're seeing. And again, if you have any specific questions about what you can or cannot do as part of this grant, those will go ahead and pop up again in the eligibility assessment. Next question we have is, can a state MHA affiliate partner with more than one nonprofit organization? I would need to know a little bit more about that and what the partnership looks like. So in that case, I would say go ahead and reach out to me via email and we can discuss that further. If we serve, next question, sorry. If we serve other counties in addition to ones listed in the opportunity, should we mention that or only focus on your list? This is a great question. We, for this opportunity, are specifically interested in those 5 identified counties. It's great if you're doing work elsewhere, but for the purposes of this project, we do only want to see concept proposals that are working in those 5 counties. So the answer is yes, please focus on our list. Oh, and I see Howie. Great. All right, next question I see is, local health departments are considered as nonprofits under your eligibility requirements, right? Yes, and I think I saw your application come in a little bit ago. If you went through the eligibility assessment and you are eligible, that's great. And if you are a nonprofit, you are eligible. If you have specific questions about your work or your project and you're wondering because you are a local health department, it's a little bit different, feel free to reach out to me and we can go ahead and work together to figure out what the best path forward is. All right, next question I see. Do we need to break down our concept proposal per county? We serve several of the counties on the list, so should it be targeted for just one, or can we include multiple? This is a kind of a yes and question, if you will, or answer, excuse me. We leave it up to you. So I can share that from our first cohort, we have one organization that is working in just one county, and then we have another organization that decided they want to work in 2 counties. So it really is up to you if you want to go ahead and target just one, or you do want to include multiple from that list. Both are completely acceptable. It really depends on what your project is and what you're really trying to address in terms of the need. All right, our next question is please review the dollar amounts for requests again. So the funding is for 2 years and up to $345,000 per year. This means that we could award a few different grants to a couple organizations, maybe 2, or we could select just one organization. Again, it depends on what the projects coming in are. We're looking for innovative proposals, so we really want to hear from you all what you think is the community need that you're trying to address and what you need to get that done. So again, the funding opportunity is for 2 years and it is up to $345,000 per year. All right, and we have one more question. It's asking, could you please provide a few examples of what the winning organizations would deliver? What I can do is I can go ahead and share from our first cohort, kind of what they're up to. One of our grantees is working in schools for youth development through arts programming, and their outcomes are really focused on improved mental health among students in the schools they're working in. Our second grantee is a partnership between one of our local affiliates and a local nonprofit. They are working at a soup kitchen to create kind of wraparound mental health support and resources. And they're focused on bringing on a peer support navigator who is also bilingual, who's doing things like one-on-one sessions, as well as running workshops, educational opportunities to create an overall mental health promoting environment at the soup kitchen. Oh, and I see one follow-up. Can an organization, excuse me, submit for multiple regions? Yes. So again, if you want to work in more than one county, you are welcome to, or if you want to work in one, that is fine too. Again, we leave it up to you all to decide what program you want to propose and what areas you're trying to address. And if you have any specific questions, like I'm thinking of this or I'm thinking of that, please feel free to reach out and I can support you in the process. Okay, and one more question. Does a nonprofit have to be a New Jersey nonprofit? This is a little bit of a tricky one. You do need to be serving the New Jersey communities, but if you are a nonprofit that maybe is, for example, a part of a greater national organization, but you're based in New Jersey, that works fine. If you have specific questions about your eligibility, Howie, feel free to reach out to me. I'll share my email on the next screen in a moment, and we can help sort that out for you. All right. Let me see if there's any other questions coming in. Give everyone a moment. Any other questions, comments? We'll leave it open for another minute here. All right, I see some coming in now. The question is, can this be a brand new program or are you only looking for existing programs? This is another both and answer. So you can, in fact, create a brand new program and propose that, or it can be a program that already exists. In our first cohort, we had both. We had one grantee who created a brand new program, and that was their concept proposal idea. And then we had our second grantee who was expanding some of the work they're already doing, and they're just expanding to the counties that were identified in the community impact assessment. So it's both and here. You can propose a new program, or it can be a program that already exists. One more question. Is there any priority given to organizations who are serving specific communities, like Spanish-speaking communities? There is no There is no priority. You do not get, say, additional points for proposing working with these communities, but it's something that will be taken into consideration when we review concept proposals. So again, we'll be looking to see the need that you identify, the mental health access gap, and how your project proposes to address that gap. So no specific points will be awarded for targeting certain communities, but it will be considered as we look at your application holistically. And again, if you have specific questions about the type of project you're hoping to submit, feel free to reach out and I can answer those more directly. Will we have access to the information provided after we conclude the presentation? The answer is yes. This will be available on our grantee website, if you will. So stay tuned for more info. We'll be sharing it out after the call. This question is, will this be expanding to Morris County at all? Right now, we are only, again, looking at those 5 identified counties. So right now, again, just those 5 identified counties that we have reviewed on today's call. The question is, how many partner organizations can you work with as part of a proposal? It's interesting you ask this because a part of this grant opportunity, and you'll see it as you go through the eligibility assessment and answer some other questions in the concept proposal, we do ask that you will, in the second year, form a community impact board. So with that being said, whether you decide to submit just by yourself or maybe you have one other organization you want to partner with, we will be asking you to develop community impact boards in year 2, where you bring together multiple partners, key stakeholders, to kind of support your project. But as part of a proposal, you can have both either yourself or you can submit with another organization. And again, if you have questions about your specific scenario, please feel free to reach out and I can answer those directly. All right, one more question here. If we completed the eligibility form and said we weren't going to partner with another organization, but then decide to try to partner with one, basically, is that okay? Yes, that is completely fine. You'll just go ahead and move forward in the concept proposal stage and kind of pitch your idea to us, explaining that you're going to partner with another organization, et cetera. If you completed the eligibility form and said you weren't going to partner with someone, if you just want to shoot me an email, I'll go ahead in the back end and just select that option for you so we can track it. But that is completely fine. You were still able to partner with another organization. Just go ahead and email me so I can keep track of that. All right, let's see. Any other questions? We'll give it another moment. And if you have any questions after this call, again, feel free to reach out. I'm going to go ahead and share that screen now. That is my email, specialprojects@mhanational.org. You will be reaching out directly to me, Harper Schwartz. So if you have any specific questions after today's call, that's how you can get in touch with me. We try and be very responsive on there. So please, expect a somewhat quick turnaround to get your questions answered. We are really here to support you in this grant process and want to make it as accessible as possible. And then just a few other reminder links on the screen here for you, how to access our full grant instructions, how to access the eligibility assessment tool, and then our Community Impact Zones grant opportunity website. I'm not seeing any other questions coming in. So what we can do is go ahead and we will end today's session. I just want to thank you all again for your interest and for attending today. And any specific questions, please feel free to reach out. We are here to support you all in this process. So thank you again and enjoy the rest of your afternoon.